big change in COVID testing guidelines. The CDC says asymptomatic people no longer have to be tested. The state's medical director for our region now weighing in. Here's Channel 5's Rudy Mireles.
The CDC released new guidance suggesting asymptomatic individuals not get tested for COVID-19 even if they were exposed to someone with the virus. One of several changes since the beginning of the pandemic, like the reversal in wearing masks, some are now questioning the credibility of new findings. Dr. Emily Pro says with any novel pandemic, new scientific data will come over time. But changes aren't limited to coronavirus or a new thing in the medical field.
Sometimes guidelines do change. We always look at the harms and the benefits, and we see that often, for example, with cancer screenings. It might be a whole age range, or it might be an age range that changes, or certain predispositions.
Another change this week came with hope for those with loved ones hospitalized. The approval of convalescent plasma as a treatment for COVID-19. But Dr. Pro says remaining adaptable to changes during a pandemic is important in case of a similar situation the nation saw with hydroxychloroquine.
It had first received an FDA emergency use authorization, or EUA, and then we found further evidence that it was more harmful than beneficial to COVID-19 patients, so it was removed.
The CDC has since tried to clarify their guidelines, saying anyone in contact with confirmed or probable cases should consider testing. Dr. Pro adds getting tested regardless of the new guidelines is key to help determine where we stand as a community. She says with the recent drop in testing demand, residents should still ask for one if they think they need one. In Brownsville, Rudy Mireles, Channel 5 News at 6.